My name is Sydney Smith, and today I'm going to be talking about the equity of ATCG, which is how the reading of DNA of all allows families to continue sharing their stories. This is coming from a recent legislation that passed in summer of 2024 called HB 885, which is the coverage of biomarker testing. So just a quick recall, which is like a refresher or introduction to key concepts. We're going to be talking about biomarker testing, and clinical utility. So a biomarker is a measurable indicator of biological processes or responses, like in therapeutic interventions, excluding patient feelings or survival assessments. Biomarker testing is the testing of biospecimens such as tissue and blood for biomarkers in certified laboratories, and clinical utility is the interpretation of test results that guide treatment and monitoring decisions which influence patient outcomes. Why was this a presenting problem? So there was a lack of insurance coverage for biomarker tests, which are used for diagnosing and guiding treatment in various diseases, significantly various forms of cancer. Patients were facing barriers to accessing these tests, which hindered their ability to receive individualized, timely, and effective treatments. At the time, there needed to be legislation aimed to address accessibility barriers to ensure patients had the option to receive cutting-edge advancements in medical practice. So here's some additional data for the presented problem. Within Hillsborough County, I will be covering leading cancer incidences. Over the past 10 years, breast cancer incidences and deaths have had an increasing trend. Prostate cancer incidences and deaths are higher than the state's average. Lung cancer incidences have been significantly higher than the state's average, according to the Florida Department of Health in 2021. And here's a visual representation of that data showing an increasing trend. Just for reference, HB 885 coverage for biomarker testing mandates coverage for biomarker testing in state employee health insurance plans and allows Medicaid to pay for testing and utility with minimal exceptions. Certain healthcare plans are mandated to cover such testing for Medicaid recipients upon applicability and requires seamless authorization requests. So for my overall main ask, I do support the bill overall. However, there needs to be revisions to include uninsured, undocumented, and communities of color to receive appropriate education and access to genetic counseling services. According to the National Cancer Institute, American Indians have a significant increase in cancer deaths, while Black and Latinx populations have had a stable, slight trend upward in cancer-related deaths in 2021. Additionally, there is very limited data on the undocumented, and then I have a visual representation showing how many uninsured patients or how many uninsured people there are in Hillsborough County, which is over 1 million. So for my recommendations for the expansion of genetic testing coverage is using a pay-per-performance model, which will likely influence stakeholder and organizational buy-in for preventative services over treatment services, according to the research from Levin 2019. Also, collaboration with community leaders of marginalized groups to enhance engagement and dismantle stigma and mistrust, according to Johnson et al. 2013. And the use of family navigators between community-based organizations and geneticists to incite help-seeking strategies and autonomy, according to Godoy et al. 2024. So the use of these strategies allows for social work values such as the importance of human relations, social justice, and those two, the importance of human relations and social justice. And here are my references.